Hi, good evening.
Good evening. Hello.
Hi, I'm Manuel Mutya. I'm going to be your student nurse practitioner for today. May I know the reason? May I know your name?
Hi, my name is Adam Rivera.
Hi, Adam.
Nice to meet you.
I'm Manuel. Can you tell me the reason why you're actually here in the clinic right now?
Of course, I'm here for a physical assessment.
Okay, so the reason why you came here is for the physical, right?
Yes.
Okay, can you tell me your full name again?
Sure, Adam.
Hi, Adam. So can you tell me your age?
I am 30 years old.
You're 30 years old, and how tall are you?
I am 5'5",
5'5", and what is your current weight?
132 pounds.
132 pounds. Um, and what is your sexual orientation?
I am male.
Okay, and all right. So let's start the questionnaire. So can you tell me any past medical history?
Um, I just had a LASIK eye surgery.
Uh-huh.
That would have been 4 years ago.
Mm-hmm.
Other than that, I'm pretty healthy.
Oh, you're pretty healthy. All right. But no history of like hypertension.
Nothing for me. No.
All right. Okay. Um, any psychiatric history, like a mental history?
Nothing like that.
Nothing like that. All right. Any recent hospitalization?
My thumb, I had gone to the emergency room because I clipped it when I was exiting the car.
Okay.
Yes.
So what happened again?
So I clipped my thumb when I was leaving the car.
Uh-huh.
And I just smashed my thumb
Alright.
between the car door.
So you've been in the hospital.
Yes.
Did you is it just like the the emergency department, or you went to the to like you stayed in the hospital?
Oh no, just the emergency department.
All right. Did they give some treatment to you when you were there?
They just with a stick. I forgot what tool was that, but they poked my thumb with that and to relieve the pressure. But
Oh, just to relieve the pressure,
Yes.
but there's no fracture.
no.
Did they perform an X-ray that time?
Yes, they did.
All right. Okay. So you never had a surgery?
No,
Like since you were young, nothing.
no, never.
Okay. All right. Let's talk about your immunization. Are you immunized?
Yes,
Like are you fully immunized?
yes,
Did you get your Hep B vaccine?
yes.
All right. But I just want to ask, are you from United States or you came from other country before coming to United States?
I came from the Philippines
Oh,
before.
you came from the Philippines. That's why you received all the vaccine before
Yes,
coming here.
that's true.
All right. And also did you receive any COVID vaccine?
Yes, I did.
How many series of COVID vaccine did you?
3. So both, all of them were from Pfizer actually.
Pfizer. When do you remember when was the last time you received it?
Yes, the last time that would have been September of 2022.
September of 2022. How about monkeypox vaccine? Did you get it also?
I did. I also got that, I would say, back in May of 2022.
How many shots did you receive for the monkeypox?
1.
Just one?
Just 1.
How about for the COVID? Did you
3.
three shots? Did you also receive your Hep B vaccine, right?
Yes.
Hep A.
Hep A and Hep B as well.
All right. Do you remember any vaccination that you received before coming here?
I have Twinrix,
Okay.
which is a combination, I guess, of Hep A and Hep B.
Did you receive also a Tdap?
Yes, I received a Tdap before. I can't remember
The other
other
vaccines.
vaccines, but
All right. So with the medications, do you take any medicine?
just Tylenol every now and then when I'm in pain, or if I've just got out the gym and I feel sore.
Do you take the extra strength Tylenol or just a regular
I
Tylenol?
did regular Tylenol.
How much do you take?
I'd say 2 pills.
2 pills. So one pill is like 500.
Yes.
So you take 1,000.
1,000.
Does it help with the pain?
It does.
All right. But in a day, how much Tylenol do you usually take?
I maybe take it every other day or 3 times a week. Not really every day.
Mm-hmm.
Um, it's more on a need basis.
Okay, need basis. Um, have you ever tried taking something else like antibiotics?
No.
No. All right. Um, so like the only you're telling me that the only medicine that you take is the Tylenol,
Yes.
right? Um, any allergies?
No.
No
No
allergies.
allergies.
How about with food? Do you have any allergy with food?
No. No.
No. All right. If we talk, are you comfortable talking about the sexual history?
Yes.
All right. So, are you like a monogamous or polygamous?
I am more of a monogamous person, although
Mm-hmm.
I'm single at the moment. So.
Okay. Is it like with a female or male?
A male?
All right. Do you practice um, like penetration or like that?
Yes.
How about like do you practice safe sex?
Yes.
Okay. Any history of STIs?
Yes.
Have you what kind of STI you had before?
Chlamydia.
Chlamydia. But it was treated already
Yes.
before. Okay. Um,
It was 3 years ago.
do you get like checked every now and then?
Every 3 months.
Every 3 months. What is the reason why you get checked every 3 months?
Just for prevention purposes, and
Okay.
yeah, I'd like to keep track of it.
Mm-hmm. So you go to your primary every 3 months to get checked,
Yes.
right? But you always practice safe sex.
Yes.
Okay, good job. Um, any concerns when we talk about sexual concept? Do you have any concerns at all?
No.
All right. So when we talk about health maintenance, do you have do you do any screening tests like for example like prostate like check or like colon cancer checks?
No.
No. Have you tried performing like a self prostate exam test?
No.
No. Okay. Have you been to a doctor for eye exam?
Yes.
What did they say about the eye exam?
I have a 20/20 vision.
Okay,
at
so
the
it's a
moment.
perfect
It's a
vision.
perfect vision.
Okay, good job. How about like dental? Do you go to a dentist?
I do.
How often do you go to the dentist?
Twice a year.
Twice a year. Did they say anything about like your teeth, like their oral health?
It's pretty healthy at the moment.
Oh, pretty healthy. All right. And you said already that every 3 months you go for testing of HIV and like STI screens.
Yes, that's correct.
Mm-hmm. How about like have you been to like have you tried doing like depression screening or like like talking to someone?
No, I have not
All
done
right.
that.
Okay. How about like dermatologic surveillance? For example, like checking if you have like unusual moles. Have you done that before?
No, I've never
Okay.
done that.
So like let's talk about your family history. So like is your family like your mom and your dad are still like alive?
Yes.
Okay. And then like any do you know any health history between them and between the two people?
Just on my father's side.
Oh, your father's side.
Mm-hmm.
Mm-hmm.
My grandmother has diabetes.
Oh, your grandmother has diabetes. Is she still alive?
Yes.
All right. Do you remember her age?
She is 83.
83. How about like your dad? Dad doesn't have anything.
No.
He's like healthy.
Yes.
How old is your dad?
My dad is 55.
55. How about your mom?
She is 57.
57. And your on your mom's side, there's nothing like pertinent health history that
No.
we need to like know.
No.
Nothing. How about like your grandmother on your mother's side? Is she still alive?
Yes, she is.
But nothing. Is there any like, for example, like hypertension?
No, she's pretty healthy actually.
Mm-hmm. How about the grandfather on
He's
your?
dead.
Oh, he's dead.
Mhm.
On your mom's side?
He's also dead.
Okay, both sides.
Both sides are my grandfather.
Do you remember the reason of their death?
Yeah, my grandfather
On the.
on my mother's side, my mom's father,
Mhm.
he passed away because of liver issues.
Okay.
I can't remember exactly what.
It's
it
from the
is.
Philippines, right?
Yes.
Is he like does he drink alcohol?
He does. I think
Okay.
that is the main reason.
Mm-hmm.
On my father's side, that's actually smoking.
Smoking.
So.
Do you remember like did he had like cancer from before?
No, I think it's more of a heart disease.
Okay, so he is like he just had a heart attack
Yes.
after like being smoker for
Yes.
so long. Okay, do you remember their age?
I don't.
Okay, all right. How about like do you have siblings?
I do.
How many siblings do you have?
I have two.
You have two siblings. Both of them are healthy.
Yes.
No health history at all.
No.
Okay. Um, do you remember if there's like some mental illness in the family that's running?
My mother.
What kind of?
I think she is a little bit. She has bipolar disorder.
Mm-hmm. Okay. Do you know if she's taking a medicine for it?
I don't know. I'm not sure actually because we're not in talking terms. Not consistently at least.
Mm-hmm. Okay. But like does she go to a doctor?
Yes, she does.
Okay. All right. You said that did you grow up in the Philippines? You said.
I did.
And then when did you move here?
Came here when I was 18.
Okay.
2012.
With your family.
Yes.
All right. And then what do you do?
I am a writer.
All right, you're a writer. What kind of books do you usually write?
Travel.
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 Mm-hmm. So you like traveling?
I do.
Okay. So what do you do whenever you travel?
I visit a lot of research-related sites. I talk to people. I interview people sometimes when I travel. I join excursions, really depending on the country.
Okay. So like how about your do you do military service or no?
I do too.
Okay. Are you like what are you part of like the army, the navy?
The Navy, reserves, so
Okay.
it's part-time for me.
All right. Any problem when you were there in the what is it like while working for them?
At the basic training, no, not really. I don't think I ever had any issues at the boot camp.
Okay, good job. So education, like are you in school right now?
Yes.
All right. What are you taking?
I'm actually finishing up my degree in psychology.
Oh wow. Okay. How is it? Are you enjoying the school or is it stressful?
I enjoy it. It's a foreign concept for me because it's been a while since I was at school.
Mm-hmm.
So I get some stress, little stress every now and then, but that's just because I'm not familiar with how to approach or include them in my habit.
Okay. But so far you're enjoying it.
Yes.
All right, that's good. Any support or social support?
Yes.
Is it like do you have a lot of friends?
I wouldn't say I have a lot of friends. I have some friends. They're pretty reliable. So if I want to spend some time socially, we get together.
All right. And then are you single, married?
Single.
Single. Do you feel safe at all at home?
Yes.
Where do you live?
I live in Lower East Side of Manhattan.
Okay. Is it like an apartment, a house?
An apartment.
Okay. Do you live by yourself?
I don't.
Okay. You live with your family?
I live with a roommate.
Okay. But you feel safe being
Yes.
with them. All right. Good job. And then any spirituality concept that like religious?
I wouldn't say I'm religious. I would consider myself spiritual.
Mm-hmm.
So um, maybe I'd go to church once a year. Catholic.
Okay.
I'm originally Catholic. Yeah.
All right. Um, is there anything that for example, like whenever you feel sick, you always pray? Is there like practices like that that you usually do?
I would say whenever I feel grateful, I pray.
Mm-hmm.
Yeah.
Okay. And then for what is your sleep habits?
Usually I would be in bed by 10:30 the latest.
Mm-hmm.
Every day on a weekday. Weekends a little bit more late sometimes, maybe 11 p.m. But I try to get an 8 hours of sleep is a must for me.
Okay, that's a good one. Do you exercise?
I do.
How often do you
I
exercise?
would say 4 times a week. Yeah.
Okay. What kind of exercise do you do? Like, do you go to the gym? Do you run?
I do go to the gym. I run sometimes, maybe once a month,
Mm-hmm.
but mostly I do weightlifting.
All right. And then, what do you do to cope stress?
I read a lot, and I also write on my free time. So I think that helps me in deflecting or dealing with stress.
Mm-hmm. And then, like, but like your emotional needs are met. You think that whenever you do that one, your emotional needs are met.
I would say so, yes. Very intrapersonal and in touch with my emotions. So
Okay.
I get to catch them when I think that it's going something is going to trigger me, or if I feel like my emotions are getting the best of me.
Mm-hmm. What kind of activities like do you enjoy of doing?
So absolutely, reading is a favorite activity that I do. Traveling, working out, listening to music, so attending
Mm-hmm.
live music.
Okay.
Yeah.
That's a lot of things, right?
Yes.
And then like do you use drugs?
I don't.
Okay. Have you tried using drugs?
I've never.
Okay. How about smoking?
I do not smoke.
Okay. Never tried smoking?
No, never.
Never. How about like drinking alcohol?
I do.
How often do you drink alcohol?
I would say maybe twice a week,
Twice a week.
socially.
Mm-hmm. How much alcohol do you drink?
Maybe I'll drink a glass of wine or two during dinner, but two would be maximum.
Mm-hmm. Every dinner.
Every dinner twice a week.
Okay. Is it like a glass or
A glass.
Okay. Do you prefer doing it with friends or by yourself?
Either or doesn't really matter to me.
Mm-hmm. At home, is there like a need that, for example, like assisting you, or you prefer doing everything independently?
I prefer doing things independently.
And no limitations.
No limitations.
Okay. And then let's talk about your like the whole physical assessment. So you said your eyes are 20/20 vision. But when you went to the eye doctor, did they say anything else? Like other things about your eyes?
They just told me to make sure that I put my sunglasses
Mm-hmm.
when there's sun. Every time I wake up and I feel like my eyes are dry, to apply some eye drops, but nothing really.
Okay. And then for your ears, is your hearing okay?
Yes, both of them.
Both of them. And then the nose, you don't feel that it's clogged,
No,
or do you always have like runny nose?
no, I don't.
No. How about on your mouth? Do you feel that you don't? There's no lumps or like a lot of like wound inside the mouth?
No,
No. How about the throat? Is it hard to swallow?
no,
No. Okay. Um, cardiovascular. Do you feel anything on your heart, like palpitations?
no, not really.
No palpitations. Never had palpitations.
No.
Okay. How about like with your breathing? Is it hard to breathe or is it normal to breathe?
I'd say it's normal for me.
Mm-hmm. How about, for example, you're running, like do you always catch your breath, like too much or no?
No, I'm pretty regulated when I run.
Okay. How about like going to the with your GI? Like how often do you go to the toilet, to the bathroom?
I'd say once a day, at
Once a
least
day?
every day.
Is your bowel movement like regular?
Yes.
How about like do you remember the color of the bowel movement? Is it
I'd say it's brown,
okay?
healthy,
All right.
solid,
Mm-hmm. But no diarrhea.
no diarrhea.
Okay. Do you take any medicine like for for bowel movement or no?
Sometimes I'd take a fiber supplement.
But it's not often.
No, not often.
Okay. Um, how about like with your urinary? Do you like void a lot, like pee a lot?
No, not really.
Mm-hmm.
Regular, I would say. I
Okay.
drink a lot of water, so.
Do you remember the color of your urine?
Clear,
Clear? Is it yellow or white?
It's
I like
white.
this. Okay, it's clear white.
clear white.
Okay. And then musculoskeletal, like how's everything like with the movement? Does it feel like coordinated?
Yes.
Okay. No there's no like hard like for example you walk, it's hard to walk. You never feel that way.
No.
Okay. How about with your skin? Like did you notice any like lumps or any bruising?
No, not really.
Mm-hmm. How about unusual moles? Did you see any like unusual moles on your skin?
Nothing.
All right. Neurological, like how's like your thinking? Is it like do you get like more how do you say that like you forget things a lot of times or no?
No.
You're still sharp.
Yes.
Okay. You never feel depressed or do you feel depressed?
No.
Okay. Like are there times that you feel sad?
Normally, yes. Upset,
Mm-hmm.
stressed, or frustrated.
Do you know what is the reason why you feel like sometimes like you're upset or depressed?
I think it's just like a combination of work or, overthinking about personal matters, but
Mhm.
nothing that's super stressful for me.
Okay. And he's with you like what kind of food do you usually eat?
I eat vegetables, squash, um, broccoli, asparagus,
Mm-hmm.
and I have my carbs, of course, white rice.
So you prefer eating like vegetables,
Yes.
and then hematological like do you have any problem with blood or anything?
No.
No. And then you said already a while ago you don't have allergies.
No.
Mm-hmm. And then like do you remember the last time you went to a doctor for like blood checks? Is your glucose number okay? Normal?
Yes.
How about the number of your hemoglobin? Is it normal?
Yes.
How about the white blood cell?
Yes.
Okay. Um, how about your weight? Like have you had like weight loss or weight gain?
No, actually, I've been pretty consistent within the last 10 years.
Mm-hmm. Okay. And then like any what is it like fever like on those past days that you like you noticed? Did you have any fever?
No.
No. Night sweats.
No.
No night sweats. And then like have you tried checking your neck if you have some lumps or like swollen lymph nodes?
No, every now and then I do, but I never notice anything.
Mm-hmm. How about like I know last time that there's a lot of people having cough here in New York. Have you had cough also?
I haven't gotten sick actually.
Do you remember when was the last time
The
you got
last
sick?
time I've gotten sick was probably before Thanksgiving, November.
Mm-hmm. But like since then you never had a cough.
No,
Alright.
luckily.
And then like have you had like high blood pressure before?
No.
No. And then you never do you have history of hernia?
No.
No. And you never tried doing like your testicles like like for checking of cancers.
No.
And then what else? Do you have any questions for me?
No questions so far.
All right. Also, I would like you to know that this video will be uploaded on the internet
Okay.
for my professor to see it,
Okay.
and I'm getting a consent from you.
Yes.
Okay. Thank you so much. I think that's actually the end of our assessment, physical assessment.
Okay.
Thank you.
Thank
and
you so much. Wonderful to meet you.
Nice to meet you.
Thank you.